Eye on Health, brought to you by Tallahassee Memorial HealthCare.
Prostate cancer is the most common cancer in men behind skin cancers. Regular screening can catch it early in its most treatable form. At TMH Physician Partners Urology, the team has nearly 100 years of combined experience screening for and treating prostate cancer. Dr. James Farrell is here to tell us about it. Dr. Farrell, I know that prostate cancer is very common among men. When should they start being screened for it?
Sure, so somewhere around 55 is a great time. But if men have risk factors, then 45 to 55 is appropriate.
And what would you consider risk factors?
Yeah, the two main ones, Trish, are men of African American descent as well as men with a family history, which includes a brother or a father or uncle on the father's side.
What sort of symptoms does this present?
Unfortunately, not a lot. There are urinary symptoms, but those are a little later as the prostate really has more cancer in it. The most common way to find it now is a blood test called PSA, and that tends to find prostate cancer 5 to 7 years before people have symptoms.
So your primary doctor is going to start screening for this generally at 55, is that right?
Right. They'll usually talk with you about it because there are a few conversations to have around it, but it's a great conversation to have at that age.
And this is a very treatable cancer if caught early, correct?
Absolutely, yes. And there is really individualized treatment for patients. Some patients have a more risky form of prostate cancer than others. Some can be observed over time. Surgeries and radiations can be options, but there are a lot of options beyond, I think, what scares people, which is just surgery and concerns from having surgery.
Right, but the prognosis, if caught early, is good.
It is, absolutely.
That's good to know. Thank you so much.
You're welcome, thank you.
To learn more about urology at TMH, please visit tmh.org/urology.
Eye on Health, brought to you by Tallahassee Memorial HealthCare.